Hello and welcome to Alliance Community Hospital's Emergency Department. I'm Dr. Dominic Catalano, the Medical Director. We'd like to take a few moments of your time to walk you through our operations here at the Emergency Department so that you'll have a better understanding of what we do, how we do it, and what to expect when you come here. Firstly, and probably most crucial, it's very important for you to know when to come to the Emergency Department. This area of the hospital is reserved for those that are experiencing life or limb-threatening conditions. A medical emergency is a situation resulting when a person has lost function on the most fundamental level. For example, when their bodies have lost the ability to perform involuntary responses and they are in critical danger health-wise. If your health situation doesn't check off on any of these above situations, you may want to consider visiting the nearest urgent care clinic or calling your primary care physician for treatment of your condition.
We need you to understand that when you present to our emergency department, there is a process for signing in. Patients are seen based on the severity of their illnesses.
Here's the general order of things as you can expect them to occur. When you're first coming to the emergency department, the primary person that you'll see initially is the triage person. This is a nurse who's highly trained and specialized to take information from you and to decide the severity of your illness and the number of minutes that perhaps you'll have to wait to be treated. For example, those that have the most serious and critical illnesses are treated first. Those with minor illnesses or injuries must wait until the others have been treated. Secondly, there is a patient advocate assistance. This patient advocate will be working with you to keep you informed of the condition of your loved ones if you're not inside visiting with them. We'll also keep you informed of the amount of wait that you must have. Thirdly, we will try to provide you with an estimated wait time. Again, this is only an approximation, and incoming ambulances as unforeseen circumstances will definitely impact on that and may delay your wait somewhat. Thank you for understanding that it may take us a while to get to you if someone else in the ER is in grave condition. We all would want the physicians, nurses, and other clinicians tending to that emergency to take the time that they needed with the patient if he or she was our loved one, now wouldn't we? Fourthly, you'll have an initial assessment. This is performed both in triage and again by your primary care nurse. Next, your physician or the physician assistant will come in and discuss with you the nature of your illness or injury and the treatment modalities that we will undertake. They'll discuss any further testing that you may have to undergo and subsequently come back with the results of those tests and explain to you what you need to do forward in terms of follow-up care. Lastly, there may be a decision to either treat or transfer at this facility. We are a primary care facility here in Alliance Hospital. However, we do not have many of the subspecialties that some of the tertiary or higher level care centers have, for example, Altman or Cleveland Clinic. Your condition may be treated well here, or if we decide that that condition cannot be treated adequately or totally at this institution, we may then advocate a transfer to another institution where it can be cared for properly. Here's what you might expect. You can expect fast, effective treatment of your urgent or emergent health situation. You can expect prompt, thorough assessment from board-certified and trained clinicians. You can expect compassionate, respectful, and private treatment with dignity. The dispensation of only the medicines that you physically require. If your condition does not indicate pain relief medication, please do not expect or demand it. You will not receive a prescription for it unless it is absolutely necessary.
Here's what we need from you.
Truthful feedback to questions about medical history, pain levels, medication, food, beverage, medicine consumption, mitigating activities, etc. Enough space to be able to quickly assess your physical and/or mental condition and begin treatment. Please respect visitor restrictions so that we can serve you most efficiently and effectively. And understanding that this is arguably the busiest, most emotionally charged area of the hospital, a place where people are scared, vulnerable, and in distress. We are often dealing with highly sensitive and life-altering situations. We ask that you give us the consideration of space and a level of respectful behavior in order for us to do our jobs most efficiently and effectively. We thank you again for your understanding.
Here's what you need to know.
Please note that during the assessment, consultation, and diagnostic processes, we may need to ask you the same question several times. Although this might seem redundant, it is absolutely necessary for patient safety, security, and privacy, and the accuracy of medical records. Additionally, there are many safety mandates from the state and federal government which require us to ask several personal questions, sometimes several times. So please bear with us as we do all we can to keep you safe and healthy and to comply with privacy and security standards. Please remember that the emergency department is a lockdown unit. This means our doors are closed and locked for your safety. Who we are: the only Plane Tree Hospital in Ohio. This means clinical excellence and extraordinary compassion, open charting, a calm, safe, healing environment, a community hospital. There are many health conditions we heal, treat, or repair. Similarly, we are not a trauma center, pediatric hospital, psychiatric ward, or infectious disease facility. Our scope is that of similarly sized community hospitals throughout the country.
Please understand that your health and well-being are our highest priority.
We thank you in advance for taking the time to watch this tutorial and for your consideration as we go about our business of saving and improving lives. Your compliance with our standards will help us do just that.